My name is Carolina Mattos, and I am an event producer from Brazil, and I've been in Dubai for about 4 months now. Well, I was referred to Dr. Nicandro for a back condition. Found out I had a lumbar tumor back in November, and he was referred from a colleague. So after talking to Dr. Nicandro a few times, we realized it was the best way to go was to remove the tumor because we didn't know exactly whether it was a benign or a malign tumor. So we had to actually go in and find out. So the best option was to remove it. So we booked a surgery for December 8th. By having many conversations with him, I felt really comfortable and confident that it wasn't too complicated of a procedure. I'm a former athlete, so have never been in surgery before. So to me, it was a pretty intense thing, especially being so far away from home. The surgery was very successful. It was supposed to be a 3 to 4 hour procedure. And I was going to be here for about 3 days, but because it was intradural tumor, which is inside the membrane, ended up staying for 5. It was a very pleasant experience overall. Just from the moment I checked in, the people, the staff in the operating room made me feel really comfortable. We were joking and they tried to make me feel really comfortable because it was my first time. So definitely not a traumatic experience at all. Very good. I'm very thankful for having the care that I did so far away from home. Dr. Nicandro in special for being so caring and communicating with my family, making them understand what was going on with me and my condition, and just being very open to questions and to me being nervous and at the same time very caring the whole time. So really thankful for it. And the staff, the nursing staff at the hospital, they were also phenomenal, making sure my mom, who was foreign also as well, doesn't speak the language really well. They did make sure to try to make her feel really comfortable. So that was really important for me as well. I definitely recommend it. I have only great things to say about it, the whole experience.
Hi, my name is Nicandro. I'm a spinal neurosurgeon and I work here in King's College Hospital, London in Dubai. I had the pleasure of seeing Mrs. Carolina, who was referred to me by a colleague of mine. Mrs. Carolina was complaining of some shock sensation on her legs, which was correlated with the location of the tumor on the lumbar spine. In between the nerves, it was involving the nerves pretty much and pushed the nerves aside. After assessing her case carefully, I discussed with her and with her family. Actually, her father is also a doctor in Brazil, and I had the chance to discuss what would be my planning. And we plan to do the surgical resection of the tumor by a posterior lumbar approach with microsurgical technique. We will be able to open the meninges, push the nerves aside, and carefully take the whole tumor out under intraoperative neuromonitoring to check the integrity of the nerves during the whole procedure. The surgery went very well. We could remove the tumor totally without any injury to the nerves. We closed the meninges and had some special care after surgery to avoid any leakage of the CSF, cerebrospinal fluid. Ms. Carolina, she had a very good recovery after surgery for this kind of intradural tumor without any complications. She had good healing of the skin and the wound, and she was discharged after a few days for the postoperative follow-up. Ms. Carolina, she had a very good recovery for this kind of tumor, and she's gradually returned to her regular activities without any painkiller anymore. I'm very happy that the tumor came as a benign tumor. It's called schwannoma of the lumbar spine, which is a relatively rare tumor and has a good prognosis, especially in this case that we could remove the tumor completely, so the chance of recurrence is very low. So most likely, Ms. Carolina, she's done with this problem and she'll return to her regular activities and normal life very soon.